It has been a growing health concern for over a decade, one that across the world has become a priority. Perhaps you haven't noticed, and if you have, it often feels impolite to say. But the facts and statistics are clear. We have a problem with obesity. Even more concerning is it has started to affect our children.
Being overweight, it affects me in a lot of ways.
We're getting sicker at a much younger age. Then it tells you why we need to address childhood obesity.
Heart disease, strokes, hypertension, diabetes, all of it is waiting down the road. And it's all preventable.
Avoiding a future population burdened by chronic illnesses and their complications is what has driven the global attention on childhood obesity.
It has become a health priority for all the countries. Over the last decade, there have been multiple and consecutive meetings at the World Health Assembly where NCDs, including obesity in children, is on the agenda, on the forefront.
This includes health authorities in Belize. Dr. Jorge Polanco is the non-communicable disease focal point for PAHO in Belize.
Recently, and there has been some cohort studies whereby they have found that the higher the consumption of ultra-processed foods by children, pre-age children up to age 8, it is linked directly with cardiovascular diseases with them as young adults. So the evidence is there. We could classify two fundamental contributing factors: the type of diet, the type of food, which is unhealthy food, which is food loaded with excess sugars, excess salts, excess unhealthy fats, and the issue of a significant rate of being physically inactive. In other words, not being physically active.
According to pediatrician Dr. Cecilia Eck, he already sees the effects of poor diet and inactivity in the healthcare system.
We get referrals to the public hospital with obese kids who come in with diabetes, early onset diabetes, and again preventable. And when you see it, you shake your head and you say, oh.
We're talking type 2 diabetes?
Type 2 diabetes, early onset. The earliest I've seen in Belize is a 9-year-old.
Recent studies have shown that in Belize, like the Caribbean, 1 in every 3 children between the ages of 5 to 19 are either overweight or obese. Even more alarming is that 67% of children between ages 13 to 15 reported that they drink 1 or more carbonated sugar-sweetened beverage every day in the last 30 days at the time of the study. Keep in mind that just 1 serving of a sugar-sweetened drink already exceeds the maximum sugar intake for children. Then, 79% of children between the ages of 11 to 17 reported less than 60 minutes of moderate to vigorous activity daily. These numbers are similar in other countries around the world, and so they've moved to create preventative policies and legislations.
Yeah, there's a lot of experience globally, and the first one that comes to my mind is the issue of taxes on healthy food and drinks. There is evidence, documented research, whereby the consumption of unhealthy food decreases in proportion to the increase in taxes. So that has been proven.
Polanco cites the example of Mexico, where since the introduction of additional taxes to sugar-sweetened beverages 5 years ago, they've recorded a decrease in consumption of sweetened drinks and an increase in water consumption. In September 2019, the Healthy Caribbean Coalition, the HCC, a network of civil societies from across the region, issued a call for urgent action to accelerate nutrition policies for the creation of a healthy environment for Caribbean children. Speaker of the House, Madame Laura Tucker Longsword, is a director for the HCC. The urgent call focuses on 3 areas: mandatory front package labeling, banning the sale of sweet beverages in school settings, and the taxation of sweet beverages.
So,
Belize has not been able to tackle any of these.
well, yes and no. Not the taxation. We have not looked at taxation. Taxation is going to be a highly political issue, and I think that the politicians will probably tackle that, the last thing they tackle. But what we have begun to work on is a front labeling issue.
It's an initiative led by the Ministers of Health, whereby they have mandated to begin finding ways to label the food in such a way that consumers would be informed as to what food is healthy and what food is unhealthy.
Yeah, I have to say that the Ministry of Health recently, as a policy, looked at banning sugar-sweetened drinks in the schools. I have to say that we've been working very closely with the BCS, the Black Cancer Society, the Belize Parliamentary Front has been working extremely closely with Ministry of Education, and we're all on the same page.
Some schools have instituted policies encouraging parents to send children to school with healthy snacks. But how do you curb a child's appetite for unhealthy food when it's literally available on every curb?
It comes with a lot of community involvement, because if you have a vendor around the school, and we have looked at those things at the Cancer Society, we've even had some training for our vendors. But if you have vendors around the school, it's not about saying, oh no, you can't make money. It is about telling you, look, this is what we're doing. You need to make the switch so that the children can still buy their snacks from you.
One of the global strategies is to look at leadership. And what that means is that at the highest level, at the highest political level, there should be that political will to move in this direction. We have the experience of many prime ministers in the Caribbean who have moved forward in increasing taxes, in banning sugar-sweetened beverages in schools. So it's nothing new. And I must say, giving credit to the Ministry of Education, over the last 2 years, that has been a topic at almost every forum, to make spaces and to enable the schools to have healthy food and finding ways to reduce the exposure of unhealthy food. But I must repeat, there is a need for policy support. I will mention Costa Rica as an example. They are not allowed to have unhealthy food, street vendors, not even the signs, a billboard, for example, around a radius of 2 blocks from any private or public school. That's a law.
While the conversations continue about banning unhealthy food and drinks in and around schools, the Front Label Initiative progresses. And despite the global evidence, the taxation of sweet beverages remains on the back burner. The consensus is, though, that whether through public awareness, policies, or legislation, we as a nation must prioritize the fight against childhood obesity.
We did not start 15 years or so ago when we should have, and now we are paying the price. So we've got to start now. We'll save their life if we start that now.